I'm Kayla, and I'm recording for Jordan for Indwelling catheter.
First, I would review their medical history, note any nurse's notes, and check the physician's orders, and I would check their age, gender, and all their allergies, make sure that they are completely aware of this procedure, make sure that they are conscious. I would have to introduce myself, perform hand hygiene, introduce myself, get two patient identifier, the name and date of birth, check it with the wristband on their wrist, and then I would ask them about their gender, age, and then all their allergies, making sure I double check, cross check everything if they are allergic to anything, and then make sure that there were no problems with the previous catheterizations, if it went in right, or if I should know anything, and then I have their knowledge on the catheterizations. Just make sure they know everything about the procedure that I am about to do, and have them tell me if there were any complications. I would assess the bladder, palpate, and if there was a bladder scanner available, I would use that. Before touching the patient, I would have performed hand hygiene and applied gloves. And then I would remove my gloves, perform hand hygiene, come back into the room, make sure the patient knows all about the procedure, and I'd tell them everything that I'm going to be doing. I would make sure that I don't need any other help, because if he is a bigger person, need extra hands on deck. I would tell them about the procedure over and over. I would make sure I gather all my materials and I have everything that I would need. And then I would perform hand hygiene and apply gloves. I would provide privacy for the patient by shutting the door, pulling the jaw around. Since we are in a small space, I cannot do that. And then I would start to drape patient, making sure that they are covered. And I will raise the bed after I drape the patient. And over side rail, which is not very easy for me. I'm not used to these new beds yet. Up to a working height. Remove their blanket, making sure to provide privacy for the patient. And assist the patient into a dorsal recumbent position. Just for my sake with the blanket, we're going to tuck it behind their shoulders. I would ask if he was able to assist me with holding the blanket. The other side rail is up since I am working on this side of him. I would have to assess the patient, make sure there is nothing wrong with their perineal area. I would wash with soap and water, rinse and dry, making sure that there is no drainage and nothing wrong with the perineal area. Make sure the patient's covered so he is warm. Then I'm going to remove. I would ask an assistant to help me, because if this is a bigger person, I would ask them to hold my light so that I am able to see as I proceed with the procedure, but we have enough lighting that I will not need that. And then I would remove my gloves and perform hand hygiene. And then I will start the procedure. I have a different pack of sterile gloves because I found out that I am allergic to the sterile gloves that come within the package. I get red and inflamed, so. Do not need this. Make sure that I have my sterile field is clean. I do have a 1-inch border. I do prefer mine to be in square shape instead of diamond. Anything that goes below the table is now unsterile, but anything above the table I have a 1-inch border. Again, like I said, I will not be using these gloves. I will be using the blue mat. Make sure the shiny side is down. Make sure you keep your sterile field within your vision at all times. I will not be using this. And now I will apply my gloves. I will reposition my box, keeping within my 1-inch border, removing the top. I will lay those down so they do not fall. I'll be getting rid of this since I will not be using that. Make sure that is snug tight on there. And keep your gloves above waist level and above the table so nothing becomes unsterile. And then I will lubricate 2 to 5 inches. Make sure I have enough on there. If it was male patient, I would make sure I lube up to about 7 inches. Lay that back down in my box. And then I will bring the box up. Make sure you do not touch the patient with your gloves. I will make sure you use my non-dominant hand to pull back to wash. We'll go from the outer area inner. And down the middle. Make sure you do not go over your field of the Q-tips. You'll not be needing that anymore. And then you will insert the catheter, having patient bear down. And as you insert, you will go until you have urine coming through. Then you will go 1 to 2 inches more. Hold it with your not dominant hand. Inflate the balloon. And give a slight tug once until you meet resistance from the balloon. Put it back in just slightly. And make sure that is all okay. And remove my sterile gloves. And then I'll perform hand hygiene. Reapply new gloves. This will be for just to move the bag from box to patient. You are going to make sure that you don't put the bag on the floor or anywhere else. Make sure that you clip it underneath the bed. This clip will clip to the bottom of the patient's bed. Get rid of all my items, make sure patient is okay. You did very well for this procedure. I remove my gloves, perform hand hygiene. Alright, apply gloves. Make sure I take note of the urine on the bag. Make sure I assess the urine in the bag, make sure that it is the right color and everything. And I would take care of all my supplies, make sure that they are in the right receptacle, the standards for your facility. Make sure I cover patient back up. I would make sure that they are okay, assess them, ask them for their comfort level. Make sure that before I leave, I would give them their call light. I will make sure that everything is alright with the catheter, so placement as well. I'm palpating the bladder. I will have to check, make sure that there is no drainage coming from the catheter as I just placed it. I will raise the side rail. Make sure patient is all okay on their own. They did pretty well on the procedure. I'll lower the bed. I'll give them their collar. And as I take off my gloves, I will perform hand hygiene before I leave the room and document the procedure.